Welcome everyone. I have my very respected guest with me, Dr. Syed Ali Raza. He is an oncologist in UK right now, and I will leave the details of the introduction to him. So today's session is about the most recent changes that GMC introduced in their registration process. So we will try to dissect this topic and figure out what are the changes and how will it impact the international medical graduates. So Dr. Syed Ali Raza.
Thank you very much, Faran, for giving me this opportunity actually to share my knowledge and my insight about the things while working in the UK and being GMC registered. About my introduction, I think that's enough. As you are working in the US, so you know this introduction is enough. There's a different trend in Asian countries where you would like to tell a lot of qualifications, so that doesn't matter. So we can formally start the session.
Oh, thank you. I really appreciate, and I appreciate your humbleness on this particular aspect. So I think I will start for the beginners, and I just wanted to know what exactly is this GMC registration, and what are the recent updates, if you summarize for us.
Okay, so GMC stands for General Medical Council. It is the registration body for the doctors in the UK. It was founded somewhere in 1858. So every doctor who works in the UK need GMC registration. And now the GMC is getting flexible with the time because this COVID pandemic has really impacted the health system all over the world, I must say. So GMC has introduced some new changes which will provide opportunity for the doctors from from US, from Australia, and from Canada to work in the NHS, in the National Health System. So GMC sets a criteria always as far, and then it registers the doctors, and after the registration, the doctors can apply for a job. And there are a lot of job opportunities there, but the trust usually demands that you should be GMC registered before applying for a job. Now comes to the recent changes. Actually, this is something important to understand, that what is the evidence GMC need to give any doctor its registration. The most important thing is the English language skills. They always want that you should provide some evidence for that. So there are details. There are 7 ways how you can provide these English language skill evidence, and you can see the details on the GMC website, or maybe we can talk about them later in the session if we have time. Then comes acceptable primary medical qualification. Usually any person from any country who has a medical school registered with WHO, this qualification is acceptable by the GMC. Then comes the overseas postgraduate qualifications, and this new thing that GMC recently introduced, overseas medical registrations. As far as I try to explore, this is for the first time that rather than a qualification, GMC gave this opportunity that if you have a certain country's medical registration, if you are registered with their medical authority, you can apply for the GMC registration. So this is something really amazing, and opportunity for doctors from around 2 to 3 continents, that they can now come and work without appearing in the licensing exams or the Royal College exams.
Wow, very interesting, very interesting. I wanted to know what are your opinion, on these recent changes. What do you think? What actually triggered this update? Do you think pandemic has any role in it, or they were thinking about this change from quite a while and just implemented right now?
Truly speaking, as I am in teaching and training for the last some years, I haven't heard of that there is something like this going on, or some discussions or meetings are going on. So definitely, as far as my understanding, COVID pandemic has really played a role in this, and and also England is going to be separated from the European Union, so they can foresee that maybe some of the doctors from the European countries they may leave NHS. Other thing is that still there are certain part of the UK which are understaffed, and as these countries, especially US, Canada, and Australia, they can rely on their medical council registration, that if they, and their exam systems, that they can that certain competencies are checked in these exams. And because GMC has a role to ensure patient safety and to uh, uh, give a standard of good medical practice. So I believe the trigger is COVID and the understaffing in certain parts of the UK, and there are a lot of opportunities.
Interesting, very interesting. Pandemic just changed the way we practice medicine at many levels. It it is a radical change all over. So just targeting the stuff that we really need to know, and I will start from the people who are applying for GMC registration from Pakistan, actually. So uh, tell me, if someone has completed house job in Pakistan, and then completed all the USMLE exams. Now, if he goes for a GMC registration, what do you think? At what level he'll be able to join the UK health system or NHS?
I believe they will be able to join as SHO level. This is senior house officer. If you talk in terms of Pakistani health system, that it is equal to medical officer. So they can join as SHO level. This is and same people after PLAB and house job. The PLAB is the license exam for the UK. So they also join at as an SHO, and even as an SHO, they get a quite decent salary.
Oh, that's great. Now, a supplementary question to this. Is there any formal application process to find out these SHO spots, or they are individualized and people go directly to the hospital to request? How does that work?
Okay, that's a good question. Actually, these our website, NHS jobs profile, you can there are hundreds and thousands of jobs, and every trust actually advertise their jobs there. So you can just go there if you are GMC registered, just made a CV and submit and apply in a trust. So there people usually apply in hundreds of trusts, and usually then they are shortlisted by the HRs for the interview.
Interesting. So that sounds like there will be a reasonable sort of competition there for these spots as well.
Yes, sometimes, even after we get queries that after applying for 300 and 400 jobs, there was not a single interview call. We have seen such cases. So when you are applying for a job, you should present yourself in a really good way. So you should work on your CV, get it checked by someone who is working in the NHS, and mention your scores, your skills, your competencies, uh, your papers, and then the candidates are picked up from there for the interviews.
Great. What caught my attention, and that will be a kind of my supplementary question, because when we take a USMLE, these exams are pretty much focused on the way the medicine practice in US. And we know that these are something very simple and basic, that the way the medicine in practice in US is a bit different from the way it is practiced in UK. So it will be quite interesting to see how these applicants who actually had an end target of staying in US now are applying for a different health system. So we'll look into it. But another question that I got a lot from many sources, and I wanted to ask you and see what's your opinion on it. And that is, if someone has completed a residency or fellowship in US and now want to move to UK for some personal reasons, there can be many. And now if they want to do a job hunt there, and if they want to follow this pathway of GMC registration based on their USMLE, what's your thought about that? How will that work? Are they allowed to do this? What's your thought?
So there are three types of registration here. In fact, four, but three registration mainly. One is general registration with a license to practice. Then there is a specialist registrar, and there's a GP registrar. So if someone has completed has fellowship training in the US, then he can apply on the for specialist registration, and for which there is a pathway called CSER, and it stands for Certificate of Equivalence of Standard Training, something like this. So there is a curriculum there for each specialty, there of which everyone who is in training in CCT training system of the UK, they follow that curriculum. So there are certain competencies that are given in that curriculum. And if you have worked anywhere in the world, but if you have achieved these competencies and you have a record for this, so you can provide this evidence to GMC, who will then look into it, and then they can register, give you a registration on their specialist register. So, and I believe you must like, if anyone is working in the US and doing training and fellowship, they must be uh, they must have some logbook where they have the record of whatever they are doing, and they must be maintaining that. So if they provide that logbook details to GMC, and then they can look into it. So he will be registered on the specialist register, and then he can work as a consultant in the UK. If uh, he's not registered in the specialist register, still he can work as a specialty registrar, or maybe in some cases, I'm not sure, but he can work as a locum consultant. He can complete his remaining competencies while working in the NHS, and then can apply for the specialist register.
Great. So for those who want to switch countries, there may be a ray of hope at the end of tunnel. I don't know. So we'll talk more about it. I think this is just a new change, and we'll see how it pans out. But it's very interesting to know that there are certain opportunities if someone want to move from one place to other. Now,
Exactly.
one supplementary question, and that is, I received that question a lot, and that is that most of the people who take the USMLE exam, they just lock themselves in a reading room and they just study for 8 or 9 months and then appear out of nowhere and then start applying for USMLE residency eventually. I see that there's a reasonable number of applicants who have never done any house job back home. Now, if they want to follow this pathway, for example, they couldn't match in US. Now, based on their USMLE, they want to come to GMC registration process. So not having a house job or internship on plate, do you think that matters, or is there any limiting factor related to that?
Yes, I believe because I tried to explore this further, that if there is something like there is a guidance by the GMC about this. As per my understanding, there will be a problem. They can start as foundation year 1 and foundation year 2. This is just after, as a medical graduate, as a UK medical graduate, after passing out, they start as foundation year 1, foundation year 2, and then they uh, join as an SHU and so on. So without the house job, based on an overseas qualification, if they apply for the GMC registration, this can be an issue, because the criteria for GMC registration, if we go to their website, that includes overseas a primary medical qualification, then overseas qualification or registration, then uh, good medical practice, evidence of good medical practice, which includes, if they have worked, wherever they have worked, they should be registered with their council or medical authority and provide good standing certificate. So this can be an issue, I believe, but we don't have details at the moment. So when some candidate, or maybe the candidates, can email GMC, and usually, because this is a new thing, and so after some weeks, maybe we will have an idea.
And I totally agree. I have seen many applicants who were just targeting USMLE exam and never joined any sort of internship back home. And unfortunately, these international exams, they are good to take, but there are many unpredictable situations associated with that. And, postgraduate trainings, residencies, they are not like 100%
Guaranteed.
approved for, until unless you develop your resume to the point where you are competitive enough. So I again support this point that while you are preparing for exam, whether a PLAB or USMLE, and if you're staying in Pakistan, just locking yourself in a reading room is not a great idea. seeing the patient, because it's so important. Because eventually you want to be a doctor. You don't want to be someone like writing or taking exam, and that's the only thing. Uh,
Yes, actually,
Anyhow,
Farhan,
we have our own views about it, but I totally agree
exactly.
with you. Uh, uh,
And just want to add something into this. The UK system, their education system, as well as how they practice in the UK, that is less on investigation base and more on a clinical basis. So they and in their PLAB exams, in their Royal College exam, they do check the clinical skills of the candidates, and the written exams are easier to clear, but it is difficult to clear the clinical aspect of these exams. And I would definitely support this idea, because I'm also in teaching and training for the last some years. So I do advise the candidates, whichever exam you are appearing, but you should ideally do a house job, get yourself registered with the local authority so you can practice in your own country as well. And then meanwhile, you can appear in the exam. But yeah, these are our views. And
yeah, I totally agree with
not
that. So another question, and that is that most of the people who take USMLE, eventually they want to end up doing some sort of postgraduate training. That's the main goal why we take these exams, not to just move from Pakistan to US, because that's not the reason why these exams are set up for. So what do you think if someone, you know, after completing the USMLE exams, now follow this pathway and get himself registered with, GMC? What are the opportunities for postgraduate training in UK for someone who had follows this path?
As I mentioned earlier, that if they get themselves registered on the specialist register, then there are a lot of opportunities. Like NHS needs a lot of consultants, so there are vacancies available in almost every hospital, in every specialty. Then they also have an opportunity to do private practice, but they have to be associated with the NHS. So there's a system like it is compulsory for someone to work in the NHS along, and then they can also work in a private setup as well. So the market is open, and I believe we are. This is a concept of the global village, and in this interview, like I can foresee that maybe after some years, US will also open its doors for the doctors who are GMC registered, showing a good gesture. So all the world can be turned into a global village, where anyone can, having a certain competency or qualification or a registration, can work in any country, and that's how the things can develop in future.
I can foresee that. I don't want to be political, but changes in the White House will eventually trickle down, and I believe that the way US was pretty strict. They are pretty strict on who can come to US and practice medicine.
And one thing to add, Faran, if you see, the GMC has also set a certain criteria and limitation that the ones who graduated in till March 2020, only they can apply for this registration. So definitely this is, that's why I can see that it's the pandemic which triggered this. But as far as my understanding of the NHS and the GMC, usually when they uh, go for a certain pathway, they initiate it, then they slowly uh, expand it for more and more. So maybe this is a temporary opportunity at the moment, but they will be looking forward to the US residency system and their health authorities, that how they look into it. And maybe then GMC will be more flexible for the new candidates as well. So anyone who is doing PLAB, he can go to US or UK, and anyone doing steps, he will be knowing that now he can also go to the UK or US. But this thing you should mention, that at the moment GMC has allowed only the candidates who qualified, who did their USMLE till March 2020, I believe this is the date they have given, and it's not for the future candidates or the current doctors who are appearing in the steps at the moment.
Yeah, I think the time has come when pandemic has triggered this thought that if there should be some sort of a standardized international exam And if someone has qualified that exam, they should be able to apply for postgraduate spots across the borders.
Exactly.
Because whenever these infectious diseases and pandemic happens, they don't see the borders. So why these exams need borders? I want that there should be a international standard of exam that is just valid for various countries with some modification depending upon, but it's pretty early to comment on it. But I think we are
Exactly.
eventually heading in that direction. Moving forward, most of the applicants who were applying for USMLE, I know by them, once they couldn't match, either they try to apply next year or they do some sort of masters in public health or physician assistant courses, or some end up doing PhDs. Now, with this thing happening, do you think that it's a good backup for the applicants?
Yes, I believe this is really a good opportunity actually, because I have seen many people who are known to me, they apply for residency, unfortunately they don't get match, and then they uh, wait for another 1 year doing simple jobs, medical officer jobs or something like this back in their home country, and getting depressed and frustrated about the situation with all the unpredictability related to the residency programs. So I believe if in that time when they which they have of 1 year or 2 years, when they are finding some difficulty in getting a match, if they work in the NHS in the UK, this will increase, this will actually improve their portfolio. This will make them a more favorable candidates even for in their match as well, because this is someone who has worked in a good standard health system for 1 year or 2 years, and more or less as you know the guidelines, they are more or less same, and I'm an oncologist, so I know that the basic guidelines for treating cancers, they're investigating them, they are more or less same. If a drug is approved by the FDA, then after a few months that drug is approved in the rest parts of the world as well. So this is an amazing opportunity, and I believe this will help them in getting matched as well. If they apply for residency, they are not getting residency, just come to the UK, start your job here, okay, and keep on applying for the residency. And I believe that every hospital would love to take a person who has already worked in a standard health system, rather than just staying in the libraries, as you mentioned, or doing electives or observerships only to build their portfolio.
Got it. Great, great. I just got a question in my chat box, and I'll just, it has two parts. And the number one was asking about, requirement of house job, yes or no. And I think we just discussed that those who had house job already done, I believe they will be preferred if they eventually get some sort of registration. They will be preferred over the people who never did some sort of, house job, because those who never had a house job may end up doing some sort of foundation year before they get into the main thing. And the next step was primarily asking about if the first year of the residency in US, which is actually an intern year, will that be counted toward that experience which may be required? So I think so that should be
Yeah,
required.
just adding, yeah, they are the UK health system, and they don't see the time. Actually, there is no limit. It is the competencies. If you have achieved certain competencies in 1 year, and your supervisor has signed these competencies, then it will be counted. So it's not the number of years, but your clinical experience and your competencies that will add value. They will be
Yeah,
acceptable.
and I totally agree that this thing just happened, and there maybe, I think there will be many individual scenarios where the applicants may have to directly communicate with the GMC to figure out where they stand in this whole process. What do you think?
Exactly. Yeah, there is a there is a crest form. There is a form which you should get signed from your supervisor, and that can be from any country. That is called crest form. Anyone who is applying for CCT training here, who hasn't worked in the UK for many months, so they can get these forms signed by a supervisor, by a consultant. They worked for more than 3 months in the back in the US or in Pakistan, The UK health system, they accept this and they trust in this, that if a supervisor has signed this form, then this candidate must be having these competencies.
Great, great. And with your experience working in UK, what do you think? Let's consider a hypothetical scenario. For example, if someone, completed all the USMLE exam, had house job on board, applied for the residency match in US, couldn't match. Now he's looking for the next match or the next spot, which will be almost a year later. Now, if he gets registered with GMC and start working in UK, what do you think? What kind of job contracts they get? Is that possible that if they want to leave after a year, is that possible or no?
Yeah, it is possible. You just need to give a 3 months notice period. Usually, even if you get a contract of 1 year, that contract is extendable. And most of the jobs, the initial contract will be of 1 year, even as an SHO or as a specialty registrar, and that will be extendable. And you can resign from any job with a notice of 3 months, even after 1 or 2 months of your job. So that's not a problem. That on your contract it will be written. You just need to give a notice period of 3 months, and this will solve this issue.
Got it. And the way my understanding is, and correct me if I'm wrong, what sounds like that those people who will get the GMC registration like this after taking the USMLE, they may end up doing a non-trainee jobs until they find a trainee spot in UK, right? Is that correct?
Yeah, it's correct. Both kind of jobs are available and both are parallel. In the like you can work as a specialty registrar in a non-training position, and in the same your colleague will be working as a specialty registrar in a training position, and there will be not much difference in your job rotas and his job rotas. So there are a lot of non-training. In fact, most of the jobs are non at the moment are non-training jobs that are available.
I see. That triggers the next question, which is at in US, we have a centralized national residency matching program, and it's just like one-time induction in a year, which either can be for the preliminary spot or the categorical spot. Like preliminary, you just get 1 year contract, and then they have to justify themselves again for the next of the categorical years, or like a combined categorical. Uh, for the simplicity and for the people who want to know or new to this thing, how will you summarize the induction system in UK, induction into postgraduate training? How does that work?
So it's quite similar. So there is a centralized training system but it is 2 times a day. The applications open. There are certain dates for different specialties. Then you apply for the residency. Then you are shortlisted for the interviews. And then after the interviews, you get a training slot. You choose a deanery. By deanery means you choose an area, and then they make sure that you get all your different rotation in the same area, in like 3 or 4 cities or 5 cities together that are in the same deanery. So yeah, it's centralized in a way, but it's 2 times a year. But there are different specialties who have different dates of application, and you apply for them, and then you wait for the interviews, and they hire you and they give you training, and that's how it works.
And let's talk about the competition. From my understanding and experience working in US, for every trainee spot, on average, 10 to 15 applicants are shortlisted for each trainee spot. And then out of 10 to 15, one is selected. That's just a rough calculation. So what is the situation in UK right now for each trainee spot? How many applicants are shortlisted?
I think it's same. It's same here as well. That there's a ratio of 1 to 10 here as well. So the training is competitive here as well. CC2 training has the same competition, and you need to build up your profiles or do audit research papers, and this all counts.
Great. And one final question, and I think we are close to the end time. So if someone has completed FCPS in Pakistan, for example, and now they want to come to US, actually they want to come to UK and plan to work as a specialist. though there are very other pathways. Now, if someone want to follow this pathway rather than doing, PLABs or stuff, they do a USMLE real quick, because they may not need that number of comparative scores. And they just complete the exam and they apply for this GMC. What do you think? How will that work?
Okay, this is a good idea actually. And maybe you are after by asking this question, you are inducing this idea to the brains who want to come come out of Pakistan. So yes, because most of the time they are going for the Royal College exams, MRCP exams, which are really difficult actually. And the PLAB, after PLAB, it becomes like that is too basic. So USMLE can be a good option for them if they are not looking for high scores. But as I mentioned earlier, to be on the specialist register, because I am also FCPS, okay, but I know that this FCPS not going to help me much to be on the specialist register. So they, after FCPS and USMLE, they can work as a specialty registrar, okay, or maybe locum consultant positions. But to be on the specialist register, again, they need their competencies as per the assigned by their supervisor as per the curriculum of the CCT. Usually, if someone is really good, and actually I wrote a blog on this, that when you are doing training in any health system of the world, do maintain a very good logbook where you put as much details as you can, and that logbook can be used as an evidence. So it's a good idea that after FCPS you do STEP, and then you can come in the UK and you can start working as a specialty registrar. Now the thing is that hospitals here, they will see your experience, clinical experience, and then they will determine your role and your job. uh, GMC will have only issue when with the if the candidate is registered on a specialist register or not. So without being on their specialist register, you cannot work as a regular consultant, or you cannot work in any private setup. You cannot do private practice, but you can work in the NHS, and the trust will really pay you good if you have completed a fellowship training in a home country. But you will be working as a specialty registrar
Yeah, the
most of
reason
the
I
time.
asked this question, that recently I came across situations where someone, had completed their home country fellowships, and either they took the USMLE before starting that fellowship, or they took these exams somewhere on their pathway, and now they want to move to UK or US. They were asking about this, and then I know a bunch of people who took USMLE, couldn't match, went back, started doing FCPS in the third year, fourth year, and now they are looking into it. They might not have
Exactly.
completed their FCPS, but there is an opportunity if they want to try UK as well. So all sort of options are on the plate right now.
Yes, and Farhan, because I'm in love with the UK health system right from start, there is no comparison. Like, it's about person liking. There is no any one health system that is the best in the world or the other is not the best in the world. For me, the UK health system have always been the best in the world, like my favorable. So definitely for these people who want to come to the UK and who tried to have a match and got disappointed and they started their training, I would definitely advise them that come to the UK, uh, start working here. And as I was going to say this to you before as well, maybe then they will stop applying for the US residency programs. I'm not want to say high words. It definitely depends upon the person liking, the Asian community, so many factors that are involved. So this is really a good opportunity, and with this feeling that they are working in a standard health care system, and some of the centers here in the UK where there are a lot of trials are going on, and so at some level you start loving to work there, and you don't want to leave these centers even if you have uh, some dream to follow. So yeah, I believe this is really a good opportunity, and definitely, and this is this is our age to do experiments actually. And because there was a time when there was certain pathway and mindset that do this only, or do this only, or this is this is the definition of the success, or this is the definition of the best. So the definitions are changing. So I believe people should look into it quite seriously, and they may end up in a better situation.
I totally agree. These updates in the registration process just open many new options, many new opportunities for the doctors across the globe. And I would say that this pandemic is something which taught us a lot at many levels, many levels. So I really appreciate your presence here. I know there may be many questions. And that is my common statement since the pandemic started. People ask very pinpointed, targeted question. Particularly, let's take an example of vaccine. They want to know a very specific thing. And I am sharing this thing since the start of pandemic and all that stuff, that there may be many unknown answers that are in the process of development. And we may sound a bit funny and silly right now that, they don't know. But the thing is that we are, I would say, from the academic standpoint, we are lucky enough that we are seeing science developing in front of us, because we read these things in books. For example, AIDS or HIV, we just open the book and start learning those drugs. Never thought about the research that happened. Now, exactly. This is a science happening in front of us. And same with the training spots, that this is something which is a big revolution happening right in front of us. So yeah. I really appreciate you, Dr. Syed Ali Raza, and I will like your closing remarks on most recent changes in GMC registration.
Okay. I am in teaching and training for the last so many years in career counseling. So this is my first collaboration with the USMLE people. So this is really interesting for me, actually. And I believe, Faran, that guys like you who are guiding the USMLE candidates and the residency programs, I believe we should have a collaboration between the different health systems, and rather than sticking to our circles, okay. And this will create actually opportunities for our juniors and our follows. Actually, I really want to say this to you, especially that God given us this opportunity, that we came out of our countries and we saw the world, and we were not knowing many things. Now, many people there who don't know at the moment, and we know a lot of things now. So we should develop these collaboration between different continents and different countries, and so that this end up opening the doors for our juniors and our fellow colleagues. So this is my first collaboration with any USMLE residency program counselor. So I'm loving it.
Oh, that's great. That's great to know. We got connected to a European health system during the pandemic, in a sense that most of the research articles, were coming from the Europe, because previously these Chinese studies, we didn't quote that much because we didn't know about the reliability of the study, or where are the quality controls and stuff. But UK has been, has done a great job coming up with great studies. That acted as a bridge, and now this next step is another bridge. Hopefully there will be many future communications between these two systems, and I really appreciate you. Thank you so much. Thank you so much.
Thank you. Thank you, Faran.